Hi, everybody. My name is Zen Chu. I'm an entrepreneur and faculty director for MIT's Hacking Medicine Initiative. I'm so glad to be witnessing the innovation this year and invited back to speak. And I hope to give you a framework for which startups can accelerate VA's healthcare mission and why the network of everybody that's attending needs to be engaged. MIT Hacking Medicine was founded 10 years ago. It's a student-led organization, and they have spearheaded over 90 events in 30 countries around the world. And we're so proud of having injected some of our best and brightest into VA's Healthcare Innovation Network. Hacking Medicine was founded on some simple principles. First, new technologies scale medicine, and they're one of the only things that can accomplish the triple aim of healthcare, of reducing costs while increasing access and increasing quality. And this new technology, though, changes care models and it changes business models. And the current large incumbents, whether they're big pharma, big med tech, big healthcare systems, adapt slowly. And so it's entrepreneurs and the startups they create that can accelerate that impact and do it in a very capital efficient manner. So when the best investors are thinking about de-risking startups and funding those milestones, they think of it with this simple framework. There's science risk, there's engineering risk, and there's execution risk. The science risk, they look to NIH and DoD for funding, and often this happens in academic research. But then you have to scale the technology and make sure that that technology can meet real-world economics. That is the valley of death. That is where most startups die. But if you can get through that, you can get and access a multiple of the NIH and DoD funding in the private venture capital markets. And we have a perfect example of that in Podometrics. We're so proud of this team. They started at MIT. They very quickly turned to the VA to help validate the technology, validate the science. They really were on the science risk side, but they have raised millions of dollars and they have progressively moved and proven out their technologies. And one of the big challenges was they didn't know if putting these technologies into patients' homes would actually work and would actually change outcomes. And they have. And because of that, they are now poised to be a major, major company that can impact not just VA healthcare patients, but patients across the world. We're so proud of them. So why are VC-backed startups better than other types of partners? VA healthcare could partner with big companies, but small startups are backed in 18 to 24-month timeframes. That forces them to have an incredibly efficient use of funds and a laser focus on which milestones and which risks that they're focused on. Now, these are healthcare startups, so of course they have safety and efficacy and clinical outcomes to prove, but Podometrics has shown that you can do that very efficiently. Now, the pandemic threatened to slow down funding, but in fact, what we're seeing, and this is the latest data from Rock Health, including through Q3 of 2020, that funding has actually accelerated. So they're on pace to put $12 billion into digital health funding. Now, much of this is consumer health and consumer services, but the larger healthcare numbers are also looking similar. So now, what are the patterns that venture capitalists look for to choose what are venture backable startups? Well, they love new technology. These new sensors beget new devices and medical devices. Those devices throw off data that become new biometrics. Those new biometrics can replace decades-old or 100-year-old healthcare biometrics. And those new biometrics can prove out new therapeutics, new drugs. And we've all seen how telemedicine has accelerated in the pandemic, and that is only going to continue. There's no turning back. But not only that, we have algorithmic care and artificial intelligence influencing care models in the bowels of these software models that unburden or promise to unburden healthcare practitioners so that they can spend more time face-to-face with patients. And that is going to create more care redesign, process redesign, and accelerate the unbundling of hospitals that was already happening. You can take these services out of the hospitals into doctors' offices or into patients' homes or into workplaces. So I started saying this a decade ago, but I feel it more strongly than ever. This is the best time in the history of medicine to be doing what we're doing to transform healthcare. And thanks to last year's event where I was at, I got to meet someone who would become my co-founder in a company that we founded in May to tackle one of the most important problems during the pandemic, which is cheap, rapid tests that don't need lab equipment so that you can have the results right there in front of you and act upon it. This is due to a new set of chemistries called quantum dot labels that we've licensed, and you can learn more about that from Josef Enriquez, our CEO, who is a veteran and was a Special Forces medic, and I'm proud to be in service to him. So now, the VA has announced VA Ventures, which we're really excited to learn more about. But a venture capital group success is determined by the idea flow, the problem flow, the venture flow, and the solutions that people can propose to them. And so it's incumbent on all of us present today to activate the VA healthcare network so that they can focus on the biggest problems and the most impactful solutions. And I'm so excited to see who they partner with and the startups that they enable. So thank you for including me this year. And more importantly, thank you for taking care of our veterans. Thank you for being on the front lines of healthcare, and best of luck in this next wave of the pandemic. Hope to see you in person next year.